Then the internal examination of the body objective is to correlate all the external finding with the internal. Any external injury, if it is transmitting internally, should be correlated. Similarly, any disease process or any surgical intervention. So all the examinations which have been done on external body, they are correlated if they are transmitting internally. So you can study the disease processes, the injuries going into the body, and all the external injuries, if they are involving the organs, each organ will be then studied. Then collection of material, blood, urine, or any other fluid within the cavities that is collected. Then disease process, you can collect the tissues which are undergoing some pathology and some injuries which if they are being reflected. Then therapeutic intervention, if they had done the splenectomy, if they have done the nephrectomy or stitching and anastomosis of intestine, all these should be noted down and you will correlate with the surgical notes also. The precaution is that now in each case, the scheme will be different. For example, if there is compression of neck, now you need that neck should be a clean dissected field, bloodless field. So you either first open the skull, then chest and abdomen so that the blood is drained out. Now when you will going to dissect the neck, it will be bloodless field. So in each case, the scheme will vary depending upon the type of the case, which cavity is to open first. Now you will examine the contents when you have reflected the sternal plate, the skin and muscles have been cut, and you will enter into the thorax. And when you remove the pleural membrane, you can examine the lungs, the lung cavity. Either there will be a collection of blood, fluid, or any other material that is examined and that is taken as a specimen. Similarly, you can examine the heart and the abdominal viscera. You will cut the peritoneum, enter into the abdominal cavity, and all the viscera, they are examined. So this is basically scrutiny of all the contents. Now you will correlate the external finding with the internal. This is the sternal plate which is cut. You will look for evidence of injuries. You will look for the evidence of therapy, any repair, surgical intervention, nephrectomy, splenectomy, cut, anastomosis, all the finding will be there. And systemic review, you will overlook all the processes which has been done. Then you will look for any pathology, any natural disease, and collect for various examination which is required. So the evidence of internal injuries, you will correlate the external injuries with the internal, and the damage of the internal organ is noted. The laceration of liver, the laceration of spleen, kidney, intestines, all the damage, they are noted down. Here you can see the damage to the liver. This is lacerated liver. Then evidence of therapy, surgical repair, cut, anastomosis, all they are reviewed. There may be splenectomy, nephrectomy, or whatever they have done surgically, you will correlate with the finding. Then overall general systemic review, because it's a complete examination. You should not omit anything, because once the body is gone, the evidence is lost. So evisceration is done, whole viscera they are removed, and they are eviscerated from the neck up till pelvic organ. They are en bloc removed. This is en masse removal of all the organs, and you will look for each organ. Each organ will be studied in detail for any pathology, for any damage, for any disease process. You will. If you like my video, please subscribe to my channel and press the bell button to receive all the notifications. And my channel name is Dr. Javed Iqbal Khokhar, Lectures on Forensic Medicine.